This is Dr. Chestnut, and this is about the most common cause of low back pain. It's called Facet syndrome, and usually I have handed you this piece of paper in the office, and I just wanted to discuss it with you and be sure that the key messages got through. The pain in the back, lumbago is the term we use, is 53% of the time due to some arthritis in the little joints on the outside of the spine. It's not due to degenerated disc in the spine or a pinched nerve. This is an aching pain, a continuous muscle spasm pain that you get in your back. It can go down into your hip pockets, around to the thighs, down to your knees, but doesn't go below your knees. If it goes below the knees, then it's more like sciatica. It starts slowly and over the years gets worse, and then eventually gets to where you're really quite incapacitated. For some people, it's standing and walking that they get this low back pain, and for others, it's sitting. This last sentence just says if you have the trouble sitting, you will often have partial relief by sitting on one buttock with the other slanted up off the chair. The pain is a hard aching pain. It doesn't feel like a muscle cramp because cramps come on and then they release. This is just an aching pain. You feel like you want to massage it, to have somebody massage it, put heat or ice on it. But unfortunately, this muscle is the deepest one in the back. It's below all your other back muscles. So those kinds of topical treatments just don't get through. However, there's good effective outpatient treatment now by physicians who have taken a pain fellowship. And that's what I wanted to describe here so that it wouldn't be, that all spooky. Lumbar facet syndrome. What we do is a lumbar facet block right here. That means use local anesthesia and numb little pieces of your back one at a time to see what's causing the pain. It is usually 3 facet joints, the bottom 3 on the right or the left or both. And so you use local anesthesia in the office, numb the skin, use an x-ray machine to put a needle down to the little facet joint and just put local anesthesia in it. And it takes 5 minutes for the local to go to work, and it should last for about 4 or 5 hours. And somewhere in the injections, the first time, maybe the second time, you'll find which joint it is, and then you know the culprit. The reason for doing that is so then we can numb that joint. It turns out that there's only one little nerve that gives you feeling in this little joint. And that nerve we can cauterize, just heat up so that it stops working for 3 or 4 years at a time. And that's called a rhizotomy or an ablation. And that's what we want to get to. So the blocks are done to try to get to the rhizotomy or the ablation because that gives you the long-term relief. So as you're working with your pain doctor, understand that all he needs to do is inject, or she needs to do is inject under your skin with local anesthesia, maybe an inch or two in to the little joint, numb it, wait, and see how you feel in 10 minutes. And then once you know which joint it is, numb that for several years. Now, there are kind of conditions where you can have some sciatica along with this. You can have two conditions, a mixed syndrome or two syndromes. But it helps a lot that we can so easily get rid of at least one of them. And then we'll wait and see if your body will heal the other, because that's usually what happens. So this pain pattern is just talking about this is the area where you get lumbar facet syndrome. It can go up as high as the shoulder blades, down to the knee on both sides. And this area here going down to the outside of the foot is showing sciatica, a nerve pain. And it feels different. It feels more electric, more burning, more acute. And the lumbar facet syndrome is just a heartache in your back. So to us, that's an exciting development now that we have that ability to take care of this without surgery. And fortunately, we are now doing less surgery for these low back pains.